Ironically, I'm an OB-GYN, but I suffered from infertility. After 2 years of trying and doing everything that I can and not pregnant, we decided, me and my husband, to have IVF. Going through IVF, that's another set of stories. There's a lot of medicine, injections, and I have to kind of block what I know as a doctor to be just a patient. Because if I keep on analyzing what the doctors are doing and I'm like, seems different with what I know, I don't think it will work. Luckily, first try we got pregnant. But what we didn't expect was we're having triplets. That was a nice surprise, but as a doctor, I know the risk. So I was really on bed rest the whole pregnancy. The physical changes was really tremendous. Emotional, psychological, because it's triplets and it's high risk, I developed preeclampsia. I had to deliver preterm. There are 31 weeks and 5 days. It was anticipated. I was given steroids and I was given medication to prevent from progressing to eclampsia. I know all the possible complications because I'm an OB-GYN again. But at that time, I was being just a mom. And I was not thinking of me. I was just thinking of the children. They're preterm. I need to hear them cry. So true enough, on the second day, my youngest had to be intubated. I was trying to be strong. I know my children are in the best hands. But it kind of makes you crumble. Because all these months that you were trying to be strong, and then you see them, and then your fears, they're in front of you. And my son was intubated. Although luckily he was only intubated for less than 48 hours. Eventually they grew. And I was telling the nurses at NICU, they're so thin. You know, with the physiologic weight loss, the first 3 days, they're already small and they became smaller pa. And you can see all the bones. Then you can see their hip bones. You're like, oh my God. And then they have to put IV, and when the nurses cannot put it, I'm like, I went back to my room and cried. I understand it's difficult to put the IV, but I don't want my children to feel that I'm there beside them and I'm crying. And then once they were growing, of course, you kind of relax a little. Na parang, okay, they're a little bigger now, a little bigger now. Then eventually you can bring them home. But it's not the end, because they go home, they're still smaller than the usual babies. My youngest, again, Hensley, had to come back after 10 days to be readmitted for aspiration, pneumonia. Then eventually we found out he has bronchopulmonary dysplasia. He cannot go on without oxygen. So he was on oxygen for more or less 6 months before we were able to slowly wean him off oxygen. That's why when I also treat my patients, I'm very strict, because when I went through it, I don't want them to go through it. Because not all parents are able to have the support that I have. I have a very supportive husband. I have a very good supportive support system at home. His parents are there, my mom is there. But not everyone has that. And when you have a preterm child, even one, sometimes it's either break or make your relationship stronger. You will see in the pictures how they became so fat naman. I think at some point we overcompensated because they were so small. When I was training, I'm more involved in the OB-GYN part. I don't get to see the preterm babies, how they struggle. I know the survival rate, but I didn't know I will be part of the statistics. So when I was there already, the children are at the NICU. Imagine my surprise how the nurses take care of the babies. And with expert hands, I can see that my children are in the best hands. So even if I was afraid they were preterm, there was no doubt in my mind that if anyone can do it, it would be Makati Medical Center. The doctor that you choose is also very important. So Dr. Pasita Lazaro is already a very well-known doctor. Aside from seeing how she works, how she operates, how she takes care of her patient, her experience kasi is tremendous also. And her bedside manner and how she makes you feel when she's treating you is very important. That's why, aside from MakatiMed, Dr. Pasita Lazaro is my OB-GYN. The best perinatologists are here also. So, part of the team is Dr. Ramon Reyes. And the neonatologist is Dr. Martinez. There's no question about it. And there was no any other hospital that I would give birth in. It will always be MakatiMed.